Restricted to medical personnel. Spirecut's patented Sono-Bath enables percutaneous ultrasound-guided hand surgery under liquid immersion. It allows to maintain the sonography probe at some distance of the skin, improving sonography imaging. The Sono-Bath is particularly useful for percutaneous aponeurotomy in cases of Dupuytren contracture, like in this patient. See the cord flexing the ring finger. The patient needs to be comfortable. No tourniquet is used. The first step is to disinfect the hand and the elbow till mid-arm. One first sterile upper extremity waterproof operative drape comprising a tight opening for the arm is installed, like for any other standard hand surgery. The drape covers the Sono-Bath. Note that the patient has still no anesthesia. A second identical operative drape is disposed over the first one, providing extra security regarding water tightening to avoid any risk of liquid contamination from the skin of the arm. Both operative drapes, taking the shape of the underlying Sono-Bath, form the liquid container, and the hand is now disposed in this container. Lukewarm sterile saline is then poured in the container until the hand is fully immersed at the site to be operated. A sterile cover is disposed around the hockey stick sonography probe with already some gel on it, avoiding any space containing air between the probe and the sterile transparent cover, as air would block the echo's transmission. The sonography probe is maintained in the liquid at some distance of the skin, improving sonography imaging. The aponeurotomy is done under local anesthesia, using lidocaine 1%, superficial and deep to the cord. Hydrodissection creates space for the cutting instrument. At the end of the procedure, the finger is straight, there is no skin rupture, and you can feel the cord sectioned at several levels. At the end, you just aspirate the liquid. Using a liquid medium presents several advantages. It avoids tissue deformation caused by the sonography transducer pressure. It facilitates the determination of the entry points and trajectories. For percutaneous instruments, as both the point of entry and the tissue to be cut are visible in the sonographic field, it eliminates the need for sterile ultrasound gel. It allows good visibility even if the skin is very irregular and the finger markedly flexed, and it avoids pain related to the pressure of the transducer. The probe can also be inclined for better imaging of cords not parallel to the transducer. Spirecut's Sono-Bath is very relevant for Dupuytren percutaneous sonography-guided surgery. With excellent visualization of the neurovascular pedicles, especially in the fingers, it improves the safety of percutaneous aponeurotomy. The Sono-Bath is also indicated in conditions where direct contact with the transducer causes patient discomfort or impedes image quality. For example, in the treatment of abscesses, for foreign body removal, or in acute pediatric conditions, and in general in all conditions where for diagnosis a standoff pad needs to be used. The Sono-Bath is a Class 1 medical device provided worldwide by Spirecut and its distributors. We hope this animation has been helpful. Spirecut remains at your disposal for further information or suggestions for improvement. Spirecut's Sono instruments are available to healthcare professionals who have undergone training and are experienced in hand ultrasonography. This video is not a substitute for the detailed instructions for use, which also outline the indications and contraindications.